Today, we're focusing on a crucial topic for mental health professionals: social worker safety awareness. This episode complements therapy training's Social Worker Safety Awareness training course. We'll cover essential points from the course, discuss effective safety strategies, and address common misconceptions in social work safety. Whether you're a counselor, therapist, or social worker, prioritizing safety is key to your practice. So, settle in and let's explore these important insights together. First and foremost, let's talk about the importance of safety in social work practice. In this profession, you often find yourself in unpredictable situations, whether it's visiting a client's home, working in schools or hospitals, or engaging with community agencies. Each of these settings presents unique safety risks and hazards. Understanding these risks is not just about protecting yourself. It's also about ensuring the well-being of your clients and colleagues. You might wonder, what are these potential risks? Well, they can be as varied as the environments you work in. For instance, when visiting a client's home, you may face issues such as aggressive pets, unsafe living conditions, or even volatile family dynamics. In schools, the risks might include dealing with challenging behaviors from students or confrontational parents. Hospitals could present safety challenges involving emotionally charged situations or navigating complex healthcare systems. By recognizing and identifying these potential hazards, you can begin to develop effective strategies for risk assessment and mitigation. This brings us to a crucial component of the course: developing skills for risk assessment. It's imperative to recognize signs of potential danger before they escalate. This might mean assessing the client's emotional state or evaluating the environment for any red flags. For example, if a client appears overly agitated during a session, it may be time to reassess the situation and determine if it's safe to continue. Let's take a moment to consider a scenario. Imagine you're conducting a home visit and you notice that the atmosphere feels tense. Maybe the client's body language is closed off, or perhaps you hear raised voices in another room. In such moments, trusting your instincts becomes vital. What's your next step? This is where effective communication comes into play. The course emphasizes enhancing communication skills to build rapport with clients, colleagues, and law enforcement. Establishing clear boundaries and assertively communicating concerns can help you navigate potentially dangerous situations. You might ask yourself, how can I communicate in a way that maintains respect and clarity? One effective strategy is to use I statements. For example, saying, "I feel uncomfortable with the way the conversation is going," can express your feelings without placing blame, which might diffuse tension. Now, let's shift gears a bit and talk about de-escalation techniques and conflict resolution skills. These are essential tools in your safety toolkit. Imagine you're in a session with a client who suddenly becomes agitated. Instead of feeling overwhelmed, you can utilize de-escalation techniques. This could involve using a calm voice, maintaining open body language, and actively listening to the client's concerns. Remember, the goal is to create a safe space where both you and your client feel heard and respected. It's essential to recognize that de-escalation isn't about suppressing emotions or avoiding conflict. Rather, it's about acknowledging the emotional state of your client and guiding the interaction toward a more constructive path. With practice, these techniques can become second nature, helping you navigate challenging situations with confidence. But let's not forget about our own well-being. As mental health professionals, we often pour our hearts and souls into our work, sometimes at the expense of our own mental science and emotional health. The course highlights self-care practices and stress management techniques, which are absolutely vital in maintaining your emotional and physical well-being. You might think, I don't have time for self-care. But think about it this way. If you're running on empty, how can you effectively support your clients? Consider incorporating small self-care practices into your daily routine. This could be as simple as taking a few deep breaths before a session, going for a walk on your lunch break, or setting aside time for a hobby you enjoy. Remember, self-care isn't selfish, it's essential. Now, let's address some common misconceptions related to safety in social work. One prevalent myth is that safety training is only necessary for those working in high-risk environments. In reality, safety should be a priority for all social workers, regardless of your setting. Whether you're in an office, a school, or out in the community, understanding potential risks and having strategies in place can make a significant difference. Another common misconception is that asking for help is a sign of weakness. On the contrary, seeking assistance is a demonstration of strength and professionalism. The course encourages you to familiarize yourself with available resources and support systems, both within your organization and externally. This could include reaching out to colleagues for support, accessing counseling services, or even connecting with law enforcement when necessary. Remember, there's no shame in leaning on your support network. As we approach the conclusion of this episode, let's reflect on the importance of safety in social work practice. It's not just about protecting yourself, it's about creating a safe environment for your clients, fostering trust, and promoting healing. By understanding potential risks, developing effective strategies for risk assessment, and enhancing your communication and de-escalation skills, you're taking proactive steps toward a safer practice. In closing, I encourage you to take what you've learned today and apply it to your work. Consider how you can implement these strategies in your practice, and remember to prioritize your own well-being. If you're interested in expanding your knowledge further, I invite you to check out therapy trainings at therapytrainings.com. This course, along with many others, can provide you with valuable insights and skills that will enhance your practice and promote safety in your work. Thank you for joining me today. I hope this episode has inspired you to prioritize safety in your social work practice and equipped you with tools to navigate the challenges you may face. Remember, you're not alone in this journey. Together, we can create safer spaces for ourselves and our clients. Until next time, take care and stay safe.